The next thing we're going to cover is one of the most dramatic and useful things you'll learn the entire weekend. It's called injury recall. What this means is muscles have memory. And muscles remember an injury. The injury can be a strain, a sprain, a blow. Injury can be a scar from an incision. It could even be as simple as the result of a needle having gone into that area of the body for purposes of an injection. It could be that benign, but really dramatic. And so the body never completely, that part of the body that was injured, never completely heals until you erase the muscle memory of that injury. Never completely heals until you erase that muscle memory. Now, I'd like a volunteer, and you can tell me if you fit this description or not. I'd like a volunteer who's had these three things happen to them: a sprained ankle, a mammogram, and a root canal.
Yep, had all three.
You've had all three? Fantastic.
Had a car.
Okay, so why did I pick those three? Now, you understand you can erase the muscle memory of any injury, but those three I just mentioned, sprained ankle, mammogram, and root canal, are particularly devastating to the body. Anything that makes the body cringe, and we often cringe as a reaction to something we're exposed to. When you cringe, it jams the body, and the body remembers that. And it affects the body, affects the entire body. When you have an old injury that's recorded somewhere in the body, it makes the body more sensitive. It taxes the nervous system of the body. And here's the most important thing. It makes the body susceptible to future injuries. Those people get labeled as accident prone. Well, that's just a dumb description that we use to cover up our ignorance. What do you mean you're accident prone? What accident prone really means is the first injury was never treated properly. And so they got this muscle memory from the first injury, which makes them susceptible to future injuries, and that compounds it. Now you got two injuries that makes you even more susceptible to the third injury, so it snowballs. If you can clear out the old injuries, big dividends. Wally Schmidt says that's the number one most therapeutic thing you can do for your patient is clear out the old injuries. So I'm going to show you how to clear out these three that she has conveniently. But the technique we're going to show you would apply to all injuries, not just those three. It's the same technique. And we're going to activate the cervical musculature, because the cervical musculature has 5 times more nerve endings than any other musculature in the entire body. There's 5 times as many proprioceptive nerve endings in the cervical musculature than any other muscles of the body. And so we're going to activate that as a method of asking, is there an old injury there? So, do you remember which ankle it was?
For the left.
Okay, can you grab your, let's see.
Want me to sit up and grab it?
No, I'll bring it to you.
Okay.
I want to take a measurement here.
Okay.
Let's see how flexible she is. Memorize this. Memorize where that is. Okay? Okay, now grab your left ankle. And it doesn't therapy localize in a clear, But we need to activate the cervical spine. Put your head into extension, way
Too much
back,
on you?
way back. She goes weak. If it goes weak, it means there's an injury where she's touching. Let go. Now, put your head into extension. Nothing happens if she puts her head in extension, so that's not it. It's when she touches the old injury and she puts the head in extension. That's when it shows up. Understand, but repeat, it's not a TL because it doesn't show into clear. It only shows when she goes into extension. Got that? It only shows you go into extension. That's the proof that there is an old injury wherever she's touching. So you have to do it simultaneously. Okay, how do you fix it? Well, you fix it by she touches the old injury, which you already verified is present, and then we go into flexion rather than extension. Again, let me do it. We're activating the musculature in the cervical spine. We're affecting the proprioceptive nerve endings. And that's how we clear out the memory of whatever it is she's touching. Then you say, okay, did I accomplish anything? Well, go into extension. And she says, it's gone. So you've cleared out the memory. Now, did it do anything for this? Evidently it did. Now, you had a mammogram, right?
One.
Which one?
No, I said I had one. Never again.
Okay.
Eat both ones.
Now, head extension. Okay, there it shows. You understand? You understand? It doesn't show into clear. It only shows when she goes into extension. So the body remembers that. It remembers that. Okay, so we're going to clear it with flexion. The mammogram machine was invented by a sadist.
Yep, I agree.
I had a patient tell me when she goes to get a mammogram, she makes them promise her in case of fire, they'll release her from the machine first before they run out the door. Okay, is this gone? Head back. That's gone. It's gone. Okay, we've cleared that out. Did it do anything to this?
Wow. My yoga teacher's going to be thrilled.
Okay, where was your root canal?
There's so many of them. I think they're on both sides. I can't tell. There's a lot of them.
On the bottom?
Yeah.
Put your finger on top of the whole row of teeth.
Okay.
And extend back. There it is. So keep your fingers there. While we're at it, put your over here, just to save time. Were they any on top?
Yeah.
It's faster to do it than it is to check.
Yeah.
Okay, now, is it gone? Head back. It's gone. And did anything happen? We did not rehearse this. And what you just saw is typical. Typical. That when you erase the old injury memory, it makes the body more flexible. Not just the right hip joint only, but the entire body becomes more flexible. For example, you could have marked how far down can they go, and then after you do it, again see how far down they can go. And you'll see the increase in flexibility. Could be any injury. Do you have any scars?
No, not really, but I had a car accident. So that affected my neck.
Good. Touch your neck. Head back. Yeah, shows. Now, not every injury is going to show. You know why? You could have accidentally fixed it. One day you're doing this and you go, oh yeah, you could have fixed it and didn't know you fixed it. You know?
Right? Wouldn't the memory still be there?
No.
Okay. That's fixed.
Head in flexion erases it if you're touching the area. So it could have been accidentally erased, but you particularly find this in athletes. This is so fantastic. It facilitates the metabolic health of the entire body when you do that. Any questions on what you saw?
Thank you.
He's asking me about the ankles. The way the technique was originally taught, for injuries from the waist down, you you separate the mortise joint. The mortise joint is between the talus and the tibia. You grab the foot and you tug like this, and that's how you treat from the waist down. And then the cervical spine was taught, that's how you treat from the waist up. And the technique is so dadgum effective. In my office, I'll often do both. I'll pull the ankle apart and I'll do the neck flexion, both at the same time. Well, one at a time. And it's faster to do it than it is to check to see if they need it or not. Obviously, we have found out that treating this end will treat the whole body, treating this end will treat the whole body. You don't have to do it from the waist down only here and from the waist up here. You don't have to do it that way. And if you want to be extra thorough, you do both ends, separate the ankle and flexion the neck. And it just does wonders for the patient because it affects the nervous system, affects the energy level, and decreases chances of future injury. Did you hear what he said? If the client doesn't want you to touch their neck, you could clear it by pulling the mortise joint apart on the ankle. You pull the ankle on the side of the body where the injury is. You don't have to do both ankles. You treat the same side of the body that the hand is touching. Do I have an alternate to mammograms? I certainly do. It's called transillumination. You know how they candle eggs? They have a darkened room and they have a light coming through a hole that has foam or velvet, and they hold the egg up and they turn the egg as the light shines through the egg, and they're looking for blood spots in the egg. That's called candling eggs. Well, we do the exact same thing to the breast. In a darkened room, we shine a light through the breast tissue to see if the light goes all the way through, to see if there's any spots that show up. And that's called transillumination. And as long as the breast is clear and there's no spots that show up, we say skip the mammogram because there's no radiation involved with transillumination. Now, if I found a spot with the light, then I might say, okay, now go get a mammogram. But as long as the breast is clear with the light shining through it, we say skip the mammogram. Could you use ultrasound? You could use ultrasound, yes. Meaning rather than the mammogram, which uses radiation. Isn't that ironic? They're checking for cancer and radiation causes cancer. So here they are exposing the breast to radiation, and then radiation is accumulative, so every time you do a new mammogram, you get more radiation. So you're just asking for trouble to get the breast radiated over and over again. What are my thoughts on thermography? It's good. Thermography does not require radiation. Thermography is measuring infrared radiation. It's measuring heat radiating from the body, does not require radiation, and it's good looking for hot spots. So thermography is good, absolutely. anything to avoid radiation. Where can you get transillumination? At my office. No, you could ask over the phone, does your office do transillumination? She asked, it probably wouldn't happen in a regular clinic. You probably need to go to an alternative practitioner because there's no money in transillumination compared to a mammogram. We're using the same light that a flashlight uses, but we don't use a flashlight. The Welch Allen kit has a arm of a bulb on the end of it that is very handy to shine through the breast tissue. You're just visually looking for a dark spot that shows up in the breast tissue. If there's a density in there, then it obscures the light from coming through. You've all put your hand on top of a flashlight and you see the red coming through. Well, that's what the breast should look like too. The light should shine through the breast. And that's what you're looking for. That's what you're verifying. So we like to avoid mammograms whenever possible. Any questions on injury recall? Dynamite treatment. This originally was idea of a podiatrist who realized the effect that the sprained ankles were having on the entire body. The podiatrist's name was Bronson, and he taught Wally Schmidt, and Wally Schmidt taught me. And since then, we've seen multiple applications of it. Somebody else want to volunteer for injury recall? Okay, now touch the ankle. Now, go into extension. So that shows, or another way it could show is she touches and then I jam it. I jam the mortise joint together. And that challenges it, and that shows also. So that takes the place of the neck in extension when you jam it. Now to fix it, you have to pull it apart. So it's this easy. Relax. See what I'm doing? I'm separating the talus from the tibia. It's that easy. Now, is it gone? Gone. Put your head back. It's gone. Now, in my office, I'll often do this, and I'll do this at the same time. I mean, one at a time, but I do them both, just to be extra thorough. Okay, thank you. Well, you're just showing that the head flexion by itself doesn't do anything. You have to be touching the area, and then you do it. So you're just clearing that there's nothing wrong with the neck to start with. Everybody in this room today can do one thing better than anybody else in the room. We all have special talents. And one of the trick is find out what that talent is and then do it. It's called following your bliss. Here's a clue. What is it that you do that makes you lose track of time? Whatever you do that makes you lose track of time, that's what you're good at. Do that. What I'm good at is taking something complicated and simplifying it and explaining it in a simplified method and getting rid of the complications. I'm good at that. And that would be a definition of a shortcut. Could you put the head into extension and then enter pause lock? Now you've got head extension locked on the body, and now that you've got it locked on your body, you can just take the patient's hand and you can just check everywhere and see if anything shows up. You don't have to have the patient keep doing this, keep doing this. This part is already locked in. That's what his question was. Could you lock in the extension on pause lock? Yes, you could. And then you don't have to go into extension for every single thing you're checking because the head's already an extension by way of pause lock. And you could just check to see if anything shows up. If you want to be double thorough, you could take them out of pause lock and see if the weakness disappears. If it disappears when you take them out of pause lock, then you definitely know that what you had found was an old injury. Old injuries are really, really common, really common. Wally Schmidt has a form for a new patient. It's a picture of the human body. And he says, mark on here any place that you were injured. Front and back. Mark on here any place you were injured. And then he'll clear out all the old injuries. And it's another way of prioritizing, meaning you're getting rid of so many compensations because the old injuries make other things show up. So you're clearing that out. She asked, can you use this on surgery? And the answer is you especially want to use it on scars. Especially you want to use it on scars. A scar from surgery, a scar by getting cut with a piece of glass, a scar from getting cut with a kitchen knife accidentally. Especially you want to clear out any old injuries. And sometimes it's benign as just where the needle went in from an injection. Good question. I said you could only clear 4 allergies at a time on one visit. The number of injuries you can clear is unlimited. There's no limit on how many injuries you can, there's no limit on how many old injuries you can clear in one session. No limit. No limit. Pause lock is not the treatment. Pause lock is the diagnosis. Pause lock is simulating the hyperextension. That's not the treatment. The treatment is flexion.
Yeah.
So no, you have to treat them one at a time.
One at a time.
You have to treat one at a time by going into flexion, if that's the method you're using, or separating the mortise joint, if that's the method you're using. Could you prioritize these injuries and to see which one to fix first? Yes, you could. Do I do that? No. Just to save time. Just to save time. Rarely do I ever have it occur that I have to clear the injury more than once, meaning the same location. Rarely do I have to do it more than once. What does that mean? It means my correction is holding. That's what it means. Well, if my correction is holding, then I don't have to prioritize it. One of the criteria for priority is it must show in the clear. So the fact that you found it in the clear is encouraging that it's okay to fix that next. But technically, you could prioritize it if you want to take the time to do that. The question was, how much time has to have passed between the injury occurring and the time you clear it? It could have been 5 minutes ago. It could have been 5 years ago. A certain amount of time does not have to have passed, is the answer to your question. Okay. I usually have to only do it once. Only rarely do I have to do it more than once. So usually it is permanent. He's asking me, could someone other than the patient go into pause lock for the patient? And the answer is yes. If for some reason the patient can't do pause lock, I can touch the area, and then I can move my feet apart, and now I am doing the pause lock for the patient. And as long as I don't break contact with my patient, the pause lock applies to the patient. And I can touch other areas. I'm actually doing the pause lock. Application of that is, you got the patient in pause lock, but now you need to turn the patient over. Well, it's pretty hard to turn the patient over and have them maintaining pause lock. So they're in pause lock. I touch the patient. I go into pause lock, and now I say, now turn over. And I'm touching them all the time they're turning over. And then after they're turned over, I say, spread your legs. They spread their legs. Now I can let go. And we have saved the pause lock. We don't have to do pause lock again. The question is, does this technique work on people who are partially paralyzed, have injuries? And the answer is yes, it does. Now remember, the purpose of this technique is to erase the muscle memory of the old injury. That is not simultaneously saying it cures the patient. The main thing we're doing is we're taking the burden off the nervous system, and we're preventing or we're discouraging future injuries of this patient. And it should facilitate healing if you can erase the muscle memory of the old injury. Does that make the paraplegic patient get up and run down this? No, it doesn't. It doesn't instantly cure paraplegic, but it's beneficial to the paraplegic if you can erase the memory of the old injury, sure. So it does apply. Question is, have I ever used this on a phantom limb pain? And the answer is yes. And what the patient does is they touch the area where they feel the pain, even though there's no limb there. They touch the area where they feel the pain, because the physical limb may be gone, but the electrical aura or extension that from when the limb was there is still present, and that's why they still feel it. Because the sensation is a characteristic of the vital body, which is the etheric body, which is the energy that surrounds the body, and you can use it on phantom limb pain. It's interesting, in acupuncture, even though the limb is missing, all the acupuncture points are still there. And they're all bunched together on the stub of where the limb was cut off at. And you can locate the points, and you could treat them one at a time, even though they're all bunched together, real close together. Definitely possible. The episiotomy scar, episiotomy from childbirth, that's a good thing you wouldn't want to have erased. And obviously the patient is touching that, not you. Cesarean scar, another good example. Okay, let's move on. Sometimes, in fact, quite often, it only shows up under stress. Like a runner will say, well, my leg cramps up on me about mile number 2 or mile number 3 when I'm running. I'm okay until mile number 2 and mile number 3. Or my shoulder only hurts me when things at work get hectic. So these people come in your office, they lay on your table, they're relaxed. You check all the muscles attached to the shoulder, you can't find anything. You check all the leg muscles, you can't find anything, because it only shows up under stress. So your job as a good kinesiologist is to pre-stress the patient. Now, we're not going to yell at them. We're not going to hurt them. Anybody have a condition that resembles that? It only shows up after you're doing something? What shows up?
When I have some stress, seems like it manifests like in my pelvis bone.
Okay. So he's going to touch, is that where it shows up at?
Yeah, right about there.
Okay. So maybe it's, now put your head back, extension. Hold.
Sorry.
Okay, so it doesn't appear to show anything in the clear. So we're going to pre-stress him. Here's how you pre-stress the patient. You tap 3 spots. CV9, which is 1 inch above the navel. CV24, which is 1 inch below the lip. And CV26, which is above the upper lip. 3 places, CV9, CV24, GV26. You're going to tap those 3 spots. That's how you pre-stress him. Now, touch right there. And let's see. And there he is. Now it shows in the clear. You would have missed that had you not pre-stressed him first. So now that you found it, now there's something you can do about it. But put your head back. Okay, that says he was injured there at one time. Relax your neck. So I'm going to treat it as an old injury. We covered this last year.
Am I supposed to have my hand?
You have to keep your hand there. That's how you keep the hand there. That's how the body knows why we're doing this. Tap the head point for whichever meridian runs through that part of the body. In this case, it's stomach 1. And you tap the TS line. And now, when he touches there, put your head back. That's gone. So is it really gone? Let's find out. 9, 24, 26. Put your hand there. It's really gone. So you can pre-stress him before and afterwards to see if it's really gone or not. Multiple uses for that. A lot of time people say, it only hurts after I do so-and-so. Doesn't hurt right now, but it hurts after I do so-and-so. Or another thing that happens is they tell you where it hurts, but when you go there, you can't find anything. Doesn't therapy localize, doesn't challenge, doesn't show injury recall, head back, nothing shows. You don't know what to do, so you pre-stress them. And then recheck. And you'll find things that you previously would not have found. It's a great trick to know, how to pre-stress the patient. Any questions on how we did that? In the foot, we're separating the mortise joint between the tibia and the talus. The separation is for injury anywhere in the body. Well, the way it was originally taught was from the waist down. And then putting the head into flexion activates the mechanoreceptor. Relax. Activating the mechanoreceptors in the neck musculature. The neck musculature contains 5 times as many mechanoreceptors as any other muscle in the body. So when you activate that, what you're doing, you're erasing the muscle memory of anything he's touching. And then I tapped the head point for whichever meridian runs through that part of the body. Here's your head points. We call them hypothalamic set points. They have multiple applications. And you'll see more applications yet this week of these points here. And again, in this case, injury recall, you're tapping the head point for the meridian that runs through the area the patient is touching. Now the head points are good for the couple meridian. Couple meridian means large intestine 20 also treats the lung meridian. And stomach 1 also treats the spleen meridian. Get the idea? Bladder 1 also treats the kidney meridian. Gallbladder 1 also treats the liver meridian. Get the idea? It's called the couple meridian. Every meridian in the body is found in the face. Let me reword that. Every meridian in the body has a head point that corresponds to that meridian. So it's good to have these memorized. We're also going to use these points tomorrow when we show you how to check amino acids. And so Wally Schmidt gave them the name hypothalamic set points. Sometimes they're called head points. They have so many applications because it encompasses every meridian in the body that it's good to memorize this and memorize their locations. So for teaching purposes, here's governed vessel 24, here's conception vessel 24, governed vessel 26. Here's large intestine 20, triple warmer 23, small intestine 19. Here is bladder 1, here's stomach 1, here's gallbladder 1. Conception vessel 24, governed vessel 26, small intestine 19, triple warmer 23, gallbladder 1, stomach 1, bladder 1. With the exception of these two, it's duplicated on the other side of the face. Okay, any questions about that? If you go under the upper lip, you can get to GV27, but on top of the lip, we call it GV26. If you lift up the lip and touch on the gum, it could be GV27. If you tap here, you're actually going to hit both of them.